Thank you everybody for being here. It's almost afternoon on this beautiful day in Seattle. It's cold, but we're glad the rain is gone. It's really exciting for me to be here at the Senior Center. Before the pandemic hit, this was such an important part of the community for people to come together. Shortly before the pandemic, I was down here touring some of their new educational programs, meeting with the seniors, and then overnight, this Senior Center had to pivot and innovate like everyone else. I hope as the press leaves here, you take a picture on the other side of this wall are all the meals being prepared for home delivery. Because this was not just a place for people to come together, it was a place where seniors actually got a really important meal of the day. And we had to pivot quickly to make sure that we could do delivery to seniors. And so I just want to thank the Senior Center and everybody who supports it for everything they have done during this pandemic. It has just been amazing, heroic work for our community. I also want to recognize we're joined today by our Seattle Fire Chief, Harold Scoggins, who's here, our head of our school board, who's here, who you're going to hear from. Of course, you'll also hear from Dwane, who is head of our Department of Education and Early Learning. Also joined by Joycelyn Thomas, who's the Mary Mahoney Professional Nurses Organization, just an amazing organization that you're going to hear us talk about. And also Tina Abdul-Aziz from the Center for Multicultural Health Alternatives. Working with community is the only thing that has gotten Seattle through the pandemic. And we have seen so many people who have suffered in the last 21 months. So many small businesses have closed, so many families torn apart, so many people in isolation. But yet we have persevered, innovated, and taken care of each other. Since Seattle made incredible progress on our vaccinations, I'm happy to say we're not only one of the most vaccinated cities in America, that as of today, 87.2% of Seattle residents who are eligible are vaccinated. And we continue to have the lowest cases of hospitalizations and mortality rate of every major American city. I was fortunate to meet with a number of mayors last week and this week, and all of them said that they held out Seattle as a model that they used for their own cities to try to get ahead of COVID and the vaccinations. But we know that as we roll out pediatric vaccinations for children who are 5 to 11 years old and boosters to those who are eligible, particularly our most vulnerable, that we have to again kind of provide more community-based vaccination clinics for our residents. I really want to thank the school board and Seattle Public Schools for everything they did on the front line of the beginning of the school year, where we were able to get so many of the students who were then eligible vaccinated because we worked with the schools and with the healthcare there and the nurses there, and it's been invaluable. And we know now working with the school board and working with the public schools is going to be critical for us getting those younger kids vaccinated. We know as we roll out those boosters, we have to do more. In Europe and on the East Coast, we're seeing a surge of cases. It is again becoming a pandemic of the unvaccinated. And we have to look at those populations who are most at risk and most vulnerable. And for us in Seattle, that's our younger kids. And we want to do all we can to protect them. And we also want to make sure our seniors have all the vaccinations they need. But we also have to make sure that our vaccination process is equitable. This pandemic did not hit all communities equally. Disproportionately, it hit our communities of color, both on the economic and the health consequences. And there was understandably resistance and remains some resistance to some of the vaccination programs and to the health care provided. And we have to make sure that in order to succeed, we have to pair with community. And we saw during this last year standing up clinics in Rainier Beach, West Seattle and the like, that it was the community-based organizations doing pop-up clinics at the senior centers, at their churches, at other community events, were some of the most successful we had to get people vaccinated. And of all the vaccinations the city of Seattle did, over half went into BIPOC arms, was just remarkable in our city. And that only happened because of community-based organizations. So we know that in order to launch our vaccine hubs throughout Seattle, that we have to make sure that we are still working with community. Lumen Field was amazing, the largest civilian-run vaccination clinic in the nation. And we were able, through that program, to reach these high numbers. But too many people would have been left behind if we didn't also have these neighborhood and community hubs. So what we're doing is this fall we have relaunched elements of our vaccine infrastructure to make sure easy access for workers, kids 5 to 11, and adults eligible for their boosters. If you can I got boosted just recently. If you can do it, do it. Beginning Tuesday, November 30th, the city, Southeast Seattle Senior Center, and the Center for Multicultural Health and the Mary Mahoney Professional Nurse Association will open community COVID-19 vaccination clinic right here at the Senior Center. The Rainier Beach Vaccination Clinic will operate most Tuesdays and Thursdays from 12 to 7 p.m. That gives people a wide range of hours to come. You can sign up at seattle.gov, and we'll get that for people so they have it, for your first, second, or booster of Pfizer, Moderna, or J&J. We want to take everybody. Whoever needs it, we want to be able to do it, and we want to make it easy for people. For the Pfizer pediatric vaccines, which is new, it'll be available for kids 5 to 11. And there are many options we'll work to distribute that vaccine quickly and easily. You can schedule an appointment at the city clinic, talk to your healthcare provider, or sign up at one of the clinics that's happening with our partner, the Seattle Public Schools. For those of you, you can also go to your pharmacy or primary care, but so many people that's not real access, and that's why we're doing these clinics and partnering with Seattle Public Schools and with community-based organizations. Vaccinations remain our most important weapon against this virus. We saw at the beginning that the virus was voracious. And in the earliest days, we were looking at going from having what we thought were 20 cases to realizing it was probably 1,000 cases, doubling every 6 days. And we were looking within 5 to 6 weeks, we would have maybe as many as 70,000 cases and 1,000 deaths. And the only way to stop it was to bring people apart so the virus couldn't communicate. We now have a defense against it, the vaccine, and that's why we're working so hard so that we can continue our lives, so people can start to get together for the holidays. We can reactivate senior centers. We can have community come together, and most importantly, so no one will have to visit someone they love in the hospital, or even worse, not be able to go to that hospital because of COVID. We are right now down the street from one of the city's testing sites. Testing is still also going to be really critical for us to stay ahead of this. And we want to remind people, if you think you have symptoms, get tested. It's free, it's easy, and it's quick. I'm really grateful for our partners. Again, we could not do this as a city without having such a great partnership for every phase of this pandemic. And here, the Southeast Seattle Senior Center has been an amazing partner from when we launched the Rainier Beach vaccination originally, to testing sites, to making sure that we could have meals delivered to seniors, to still having that connectivity for families here in the South End has been amazing. And of course, the Mary Mahoney nurses are infamous here in this city. It's true, and I just want to say, when I was talking to our state legislative body, a person who couldn't be here, Representative Sharon Tomiko Santos, and we were trying to figure out how do we best get our community organizations, and she said, well, you can't do it without Mary Mahoney. And it's true. They're just the roots in this community, and developing that care has been so critical. So I just really want to thank everybody for their work. Thank you, Barbara, for your deep commitment for helping us. And it will be an invaluable resource for our kids, our families, our community members. And before that, I want to say again, I have a modest goal. I want 100% of Seattle to be vaccinated. Now, we may not be able to get there, but I think we can, but we will only do it if people still start to lift up clinics like this, bring the people they know, trust the people that are here, and move forward. And we do it because of the great partnerships we have together. And so I really want to thank everyone for being here today. And then next you're going to hear from Barbara Chamberlain, who is going to give some words on how her organization has been working to fight this pandemic and how important this clinic will be for their work too.
Thank you, Mayor Durkan. Good afternoon. I am Barbara Chamberlain. I'm president of the Southeast Seattle Senior Center Board. I'm also a longtime resident of the Rainier Valley, and it's my pleasure to share in this very important announcement for the residents of the Rainier Valley and beyond. We will accept people here from anywhere. On behalf of the board and staff, I would like to welcome Mayor Durkan and your staff. Appreciate all of you being here for this. And a very warm welcome to our Southeast Seattle Senior Center volunteers, participants, and community members today. I really want to thank our staff and volunteers here for what they have done. And part of that is the meal program that's going out 5 days a week, up to 100 now, 30 or 40 meals a day. We were up to 170 or 80 a day. And we assume as the cold weather starts, we will get some more added back in again. But they have done a magnificent job. And if you want a volunteer, the day before Thanksgiving on Wednesday, we will be putting out meals for Wednesday, Thursday, and Friday in one day. So extra volunteers are welcome. Kate is the one to see to sign up.
And all the news organizations on your Cryon are going to put that number.
But I'm so proud of the staff and the volunteers that have put this all together, and Jamie and all of the calls and visits that she makes and her volunteers make with our people in the community who need contact. They are stuck home alone. They have no access. So I'm so proud of them. I am excited about the announcement of this vaccination program in cooperation between the city and the center, and we've done some cooperating earlier on with an earlier program, scheduling vaccinations. Our goal is for every senior, note the every, in the area to be fully vaccinated and to reach out to all of our neighbors in the community. We would like to see any and all residents of Southeast Seattle fully vaccinated for the benefit of everyone in the community. Expanding our motto, we provide services and support for aging adults, and in this case, we want to reach to all residents in the Southeast Seattle area to see everyone fully vaccinated. That is our goal. We appreciate having the opportunity to set up that vaccination program here and to make appointments for people. It's so beneficial, and our members and our community really do support that and appreciate it. Thank you all for being here today. And I would like to introduce Dwane Chappelle, who is Director of the Education and Early Learning Program for the city and was at one time principal at Rainier Beach High School.
Thank you for that introduction. And again, good afternoon. I am Dwane Chappelle, Director of Education and Early Learning for the City of Seattle. And as just mentioned, it's great to be in the neighborhood. I am the former principal of Rainier Beach High School, and so it's good to actually be here celebrating this new vaccine resource for our South Seattle families. At the Department of Education and Early Learning, we support the health and well-being of our Seattle's children, and we do this by using evidence-based strategies. And by doing that, we also provide equitable educational opportunities. We provide student and family supports. We also provide high-quality learning environments for our scholars from both birth through post-secondary, which is super exciting. And I'm just fortunate enough that in this job, I get to see how our culturally specific services have best met the needs of our students who are furthest from educational justice, and that's really rewarding. We all know that, as was mentioned earlier, that COVID-19 created significant challenges, but at DEAL, we developed new programs to meet the community needs. And so early on in this, our partners stepped up to provide child care for our essential workers. We modified some of our FEP levy investments to meet the needs for our school-based health centers, to remote academic and enrichment services and programming to continue. So with our strong partnerships and deep commitment to the K-12 community, the Department of Education and Early Learning, what we're leading is our city's outreach efforts to ensure that there is more equitable access to vaccine information for kids and families ages 5 to 11. As Seattle Public Schools, Public Health, and our clinical partners are hosting vaccine events, the City of Seattle departments, including Parks and Rec, our good partners, the Fire Department, the Office of Arts and Culture, and the Seattle Public Library, just to name a few, are coming together for us just to ensure that we're supplementing their work by connecting with hard-to-reach populations, and any gaps that exist, we want to make sure that there aren't any within the county and our Seattle Public Schools vaccination efforts. Super excited about that. With the stark difference in vaccination rates between people of color and their white peers, we know that families want to receive information where they feel safe and with people that they trust. So to support those needs, we're partnering with trusted community-based organizations to develop this culturally specific information and to distribute prevention and vaccine information for families to support them, to support educational events and vaccine events in a culturally responsive way. So through our efforts at the city, we have a goal of vaccinating 10,000 children ages 5 to 11 over the next coming months. We want to make sure that when families are ready, they have a location in the heart of the community to get educated and vaccinated. This is how we keep our communities thriving, safe, and our students healthy and ready to learn. So what I'll do now is hand this off next to our Seattle Schools Board President, Director Chandra Hampson. Thank you.
Thank you, Dwane. Hini Karagin, it's very good to be here with you all on the land and traditional territories of the Coast Salish people. I couldn't be more excited to be out of the bowels of John Stanford Center and out of my home addressing countless issues that every school board member throughout the country is dealing with during this incredibly difficult period in our history. And there is no more important aspect to all of our collective fight than being here together in community and finding ways to combat the COVID pandemic. With our series of school-based and regional clinics, we've seen incredible success in terms of the number of students and families that we've been able to vaccinate. And having this Rainier Beach neighborhood clinic available won't just strengthen that effort, but it also is going to make the vaccine and critically information about the vaccine available to many more families and students that face the biggest challenges in terms of accessing not just the vaccine, but barriers to really, really good information from credible messengers. During our first round of vaccine clinics last spring, in partnership with the City of Seattle, Public Health, and both Seattle and King County Public Health and the Fire Department, we did our first round of vaccination clinics, and then that was for students 12 and up. Our second round of vaccination clinics we did early this fall, again in partnership with Public Health, both Seattle and King County. There have been tremendous partners. They also take my emails when I freak out about any particular thing that is concerning me in the line of trying to protect our families and our students. They will actually respond to me very readily and provide me more information that I can help get out to families. And then our third round of vaccination clinics, which are currently underway, and that's also in partnership with Public Health of Seattle and King County. That's for students age 5 and up, and I'm happy to report some pretty exciting numbers. In our 17 school day clinics that we've had, we've already vaccinated 1,791 individuals. Our 5 regional clinics, we vaccinated 1,629 individuals, and in total, 3,420 vaccinations just in that short time. And then we have 2 additional clinics coming up over the next couple of weeks, 18 school day clinics and 5 regional clinics. We all know that at this point, well, I shouldn't say we all know, it is understood that vaccination is the most important line of defense against the virus. When we spent some time recently speaking with our families about the prospect of their students as young as 5 receiving this vaccine, we understood the level of frustration and fear and lack of information that is still present, particularly with communities that have been historically not just disenfranchised, but truly injured, life and death matters, by the healthcare system. And we also know that there's a tremendous amount of mistrust in many of our systems because of racism. And as such, they really wanted us to hear that those things are true for them. And they want to make the right decisions. They don't always have access to information from trusted individuals. And I see this clinic as a place where those types of conversations could happen, where maybe a family isn't yet ready or needs more information, and it doesn't happen in that first meeting, but maybe it happens in the second or the third, and they eventually get comfortable with this really amazing opportunity that we have. We're so fortunate that we are able to keep one another safe with this vaccine, and that they can get to a place where they either feel comfortable with it, or they can go through the process, as somebody mentioned, of making other decisions that will help keep them and their family safe. And we have to be as open to talking to them about how they get exemptions when they're not in that place. Maybe they have medically fragile students in their household. We need to be hearing all these stories, and hearing all these stories and holding all those stories is part of how we're going to get our relatives vaccinated. Certainly, I feel incredibly lucky, and I just want to shout out to the Seattle Indian Health Board for the incredible campaign that they've done in all of our communities to promote these efforts, and I kind of want to hold them up as a way that we need to do more to get the word out about why these vaccines are safe and effective, and why they're going to be super helpful for our children as well. So overall, I just couldn't be more proud to be here with everyone today. This demonstrates our community's collective commitment to the health and well-being of our community's children and families. And if we can't come together over this, then we have bigger problems. But we have, and as Mayor Durkan said, it's been incredibly effective. But we do have more work to do, and I'm so grateful to have the opportunity to share in the excitement about doing that additional work and communicating more broadly about this important vaccine. So for that, I'll take it back to Mayor Durkan, and thank you very much for allowing me to be here today.
Thank you very much for that. Before we take Q&A, I do want everyone affiliated with the Senior Center here, raise your hand so that we can recognize you for your amazing work. This has been an exhausting and depleting 21 months for people. You hear that? And the fact that people still show up and continue the work is really a tribute to them and to the tightness of this community. And you're sitting in one of the most diverse areas of Seattle, and in fact of the state. And one of the things we haven't mentioned here, for example, is we're working with our Office of Immigrant and Refugees to make sure that we can distribute information in multiple languages, because we serve so many people who don't have access to information in English, and we have to make sure that we can provide that. And so only by working with those trusted community partners and trusted community-based organizations that already were there doing the work, that's who we have to empower. And by doing that, we keep all of us safe. So happy to take any questions if anyone has any. All right, spread the good word. Thank you very much, and thank you to everybody.